So my name is Chris Cottingham. I am currently the Patient Safety Officer at Harborview Medical Center. I've known Mary Jo for a very long time. I've been at Harborview officially for about 11 and a half years. I say officially because I actually started off at Harborview and UW Medical Center as a travel nurse. My background is all in critical care, specifically trauma and surgery. I've spent time in emergency departments and flight programs. And I've spent a lot of time in my career being an educator, a clinical nurse specialist. And one of the things that I developed this kind of expertise in is helping people make posters. So that's what we're going to talk about today. So the kind of the gist of everything I'm going to go over in the slide deck you've got on your handouts. So this is your reference. Another great reference, if you go to seattlenursingresearch.org, all of this information is also there. And there, if you look about large-scale poster making, there are actually a lot of great services. If you have enough money, you can pay somebody to, you send your abstract and they will just do it for you. So there are a lot of really great resources out there on the web. What we're going to do is go over some of the basics about getting your abstract, things to consider, and then how you get from that abstract that you spent so much time trying to get down to that word limit. You guys all remember how challenging that was, to a full-blown poster of however large it might be. Okay, so that's what we're going to do. So why do poster conferences? There's a lot of times you're going to use posters in your career, and it's not necessarily going to be professional conferences. I know people that have wonderful poster making skills and they're professional moms. So these really do work. The tenets we're going to talk about are going to be exactly the same. So you guys have all done research, evidence-based practice?
That's what they're working on.
You're working on right now. Okay. So there's a variety of different poster methods out there, or poster content out there. And depending on which one you're going to do, the layout might be a little bit different. The basic considerations are the same. So people do this to publish their research. Just a word about research, because I spend my life in doing QI stuff. Just be really careful if you're doing a quality improvement project that starts off as a QI project and then you want to try and make a poster out of it. There's a lot of considerations that you don't normally think of. You've spent the last 4 months of your life doing something. Of course I'm going to write a poster about it. Go to SNRC, go to somewhere else. And there are some considerations, so just check before you do that. You might actually have to do a human subjects review or an IRB or something like that. Okay, so we're going to go through that. Check with your institution. Okay, another really popular one that I suggest you do, maybe even for your units, is creative solutions. So again, unique programs, successes, educational summaries, case studies. Posters are a great way of summarizing, putting stuff together. One of our departments at Harborview, our respiratory care department, actually has a big monitor that they use, and they do write up case studies. This is one of the things that their leads will do. It's something of interest. It's an interesting lesson learned, and it's a great way that they have of sharing that educational material with all of their staff that can't be there for the in-service. So that once you get these posters, there's a lot of things that you can do. Okay, another word about a kind of a gotcha before you start putting your poster together. If you're doing this for work, your work belongs to the hospital. It's called intellectual property. If I was a member of a team but I wanted to present this at a certain conference, you need to check with the other members of your team and you need to check with your hospital. So you don't have ownership, even though it's your blood, sweat, and tears that did this. So again, just kind of be careful with that. Okay, so you guys are in the process of turning your ideas into abstracts. So you've got all of your process, and you guys have already, are you doing this already? Maybe I'm going a little bit far back. You're in the middle of doing this. Okay, so there's a variety of different ways of this. I personally like an A3 approach, which is everybody familiar with an A3 piece of paper is? It's a little bit narrower and longer than a legal-sized paper. It's a normal-sized paper if you go anywhere else in the world besides the United States. And an A3, you should be able to get everything on this one piece of paper. including visuals and that sort of thing. So it's a great way of distilling your ideas down, and that will translate into a poster. Okay. Okay, so you've got your abstract put together. So hopefully I've caught up with you guys now and where you are in this. So you should be getting some guidelines from whoever's organizing this. So Mary Jo, you're organizing this?
Yes.
Okay. All right. So you both are organizing this. Okay. All right. All right. So you're going to get, when you get accepted by these guys, or if you submit to a conference, you're going to get something called an acceptance letter. And in that acceptance letter, there will be a whole bunch of directions about what they can accommodate for posters. What's the presentation format? There are a couple of larger conferences out there now that don't do posters. They have got big screens, and you basically plug in your USB drive, and then you've got your screen. So there's really no production pressure. It's really kind of slick when it works. But they will give you a maximum poster size based on how they've got it planned. That poster size might be 2 feet to 3 feet. I just got accepted to do a poster, and I've got to figure out how to get my abstract to something that's about that big. It might be 4 by 8 feet. That's the maximum size. It doesn't mean that if you don't have enough content to fill up 4 feet by 8 feet, you don't have to, you can make it smaller. That's perfectly okay. They're also going to likely give you some other requirements for your poster. Some organizations require that you have these specific components. You need to have a subject. You need to have a reference list. You need to have a copy of your abstract somewhere in this. Others are not so prescriptive. So again, you want to meet the specific presentation standards for the group that you're going to be presenting to. All right, so they're telling you what you want to do. Okay, other things to keep in mind. Again, I mentioned that whatever you do, you're representing your organization. So you guys are going to be representing Northwest Hospital, UW Medicine, whatever it might be. Does your institution have specific standards? UW Medicine has a color scheme that you're supposed to be using. It's got font requirements. The idea behind doing this is that they all look somewhat uniform. So if you've got a lot of posters at a specific area, it's going to create a presence. So find out what your specific graphic standards are. If you don't have it and you're all coming from one group, this is our internship group, maybe you want to create your own standard template. If you're not used to it, that will actually make things easier. So that's something else you might want to consider. This was a very, very old one that we had at Harborview long before we ever had such things as graphic standards. And somebody in our education department made this up, and that was what we used for a long time. Okay, so you've got your acceptance letter. You've got an idea about what you're going to need. So is this going to be a large format poster, or is this going to be a video presentation? The next thing you need to know is what are your resources? You might, if you don't have access to a large poster printer, UW's got one that's publicly available. I don't know if the hospital's got a media office. Okay.
We usually have to send them out.
Okay. So what have you got available? What's your budget for this? Just because this is kind of the standard doesn't mean that you can't have a really, really good poster with different pieces of paper off of a color printer that are matted and then planned within that size limitation. I've seen some really, really good ones at national or international conferences that it fit in somebody's carry-on. And it was a bunch of 8 by 11 mats, and they put it up and they put it together, and all of the components were there. Visually, it hung together just like a large format poster. So just because you don't have a budget doesn't mean that you can't do a really, really good poster. You're going to keep in mind the same concepts that we're going to talk about. Does that make sense? Okay. Okay. And now we're going to talk about graphic things and how to make this look professional. The thing I want to reinforce, because I probably won't say it enough, is that the most important thing is going to be your content. So it's really about having good quality content, making sure that you know, if you've got metrics or whatever it might be that you're doing, that the content is there. So that's a lot of that abstract preparation that I kind of blew through, making sure that it makes sense to what's going to be your target population. This is going to be other people on your units. This is going to be a professional association, whatever this might be. Okay. Have I lost? Everybody's still awake? Okay. All right, so the first thing we want to do when we've got this, I've got all of my content there, and what we want to do is divide this up into some logical chunks. Again, depending on who you're presenting for, they may already give you the chunks. You need to have a purpose section. You need to have a methodology section. There might not be chunks. So Mary Jo said you were going to be using the Seattle Nursing Research Guidelines. We give you examples of what those chunks could be. We don't mandate it if you're going to present to SNARC. And then we've got examples of chunks of how to chunk this up for QI, for research, for evidence-based practice, for creative innovations. So we've done kind of pulled together a lot of different sources and captured them into what those guidelines are. So these are examples of what those chunks might look like. It may be a background or a problem statement. This is my hypothesis, or this is my this is what my intervention is based on. The methodology or the description of what I did. These are my solutions and findings or my recommendations. Okay, so kind of a logical thing. If you, when in doubt, base it on what the abstract showed. Okay. All right. Now, when you're going to put this together, these posters are essentially large PowerPoint slides. That's essentially how you're going to put them together. And each of these things are a function called a text box. Are you guys familiar with text boxes? Okay. Yes? Okay. All right. So what you want to do is organize each one of your chunks as a text box, and that's what you're going to create it into. And what I recommend doing is coming up with a model text box. That's going to be, you're going to have your font, you're going to have the colors, you're going to have everything else that we're going to talk about, and you're going to copy and paste it. You're going to alter it. So essentially, you don't have to recreate it every single time. That's the easiest way of doing it. Okay, so all of these are just text boxes on what's a very large slide. All right. So, did you guys give them size limitations?
I'm doing the 4x6. I gave him ambassador slide with Northwest on it.
Okay.
As a template.
Okay. So your posters are going to be 4 feet by 6 feet. So what we're going to do when we come together is you're going to go into design, and under specifications, you're going to say 4 feet by 6 feet, which actually may end up being 2 feet by 3 feet, because I think that's larger than what PowerPoint can accommodate. So you're going to cut it in half, and then when it goes to production, they're going to tell them to double the size. So you basically are designing what will be a 4 foot by 6 foot slide. Okay? So I'm going to go in, I'm going to create my slide, and you're going to use the template that you get from these guys. Now, a word about the text boxes and how you're going to put that thing together, the information together. If you've seen slides like this, which is when most people see PowerPoint, you need to think about these slides what are they used for? Where is most of the information coming from? Is it the slides? No, it's me. They are a visual aid for me. In fact, some people might argue they're actually a crutch. Okay? They're there to supplement what I'm already saying. Now, your abstract, or when you're writing a manuscript or a website, you have to do a lot of description because there's nobody else. Everything is being communicated by that. Posters are a little bit in between. So you have to have enough information that it can hang together without you guiding it through. So using slides like this and just formatting it for a poster never works. It's not enough detail. Taking your abstract or a monograph or something else that you wrote, and then just saying, okay, this is these paragraphs, and I'm just going to then turn it into text boxes, also doesn't work. You need to go somewhere in between. Okay? The other thing that we talk about, or you need to keep in mind when you're doing posters, is your viewers. Now, have you guys ever been to a poster fair? Okay. So I actually, because again, I kind of like posters, when I go to a conference, I will actually do some time studies, because I'm kind of a geek like that. Do you know how long most people, as they're kind of walking through, and how long do they spend at each poster? Actually, probably, if I'm just doing the kind of what I call the museum approach, I'm just kind of walking by, I've got maybe the title and then that's it. So less than 30 seconds by and large. Okay? You're going to have the people that they know what your topic is, they've already circled that in the abstract. Those are not the folks that you need to worry about because they have an interest and they're going to seek you out. What we want to do is visually pull this, create this so that it's inviting for the reader, so that they're going to stop longer than the 30 seconds to just do the art walk. Okay? All right. So text boxes. So as you saw in the canine therapy dog poster before, you're going to tend to use bullet points. You don't always use bullet points if you've got a single idea. Then it's just a little paragraph. Okay? For more complex segments, you're going to use bullet points. Because if you're looking at the two of these, and you should be able to see this in your handout, which one looks more intimidating? The one on the left. It's thick, man. I have to read it. This is what I call pre-digesting. I've already kind of, again, it's chunking it up the information. I've already hit the highlights. I've made it easier for you to scan and remember the information or to process the information. So bullet points are better than multiple paragraphs. However, again, don't do bullet points if you got just one single idea. Then you're just going to have a couple of lines, and that's totally okay. All right? The other thing we want to do with our text boxes is, again, to make it easier for our viewers to digest and determine what's the title versus what's the content. So if you notice, the title is going to be differentiated. It might be based on color, it might be based on font, it might be based on the size of the font. So if you notice, this is yellow, this is really different. This is yellow, it's italicized, it's thicker than anything else. Okay? The other thing that I want to do is justify it. So if you noticed in our text boxes here, I've got everything I've got a bullet point, I've got the fonts lined up so that it's not going past the bullet point, so that it's really obvious that this is a new idea. Because if I let the text wrap back on itself, it's going to look like a paragraph. And we know paragraphs are scary because they look like something I need to read, right? Okay, so that's called a left justification. These are our other potential justifications. So, center justified, everything's going to be aligned along the center. Does that look easier? No. Right justified. It's confusing because that's not, in English, we're taught to read left to right. Our brains are programmed so that we start on the left and we go to the right. If you were doing this in Japanese, then that would be something totally different. If it was in Hebrew, it would be totally different because that's a different language schema. So that also doesn't make sense. Fully justified. That means it's gonna spread out the words or compress the words so that it's totally lined up on the left and the right. Okay? It looks nice because the right side is nice and even. The problem is, you and I, when we're skimming information, we go along the top of the words. That's how our brain works when we're reading something quickly. So by fully justifying it, we're changing the space between the letters, and it's making the brain of the reader work harder. So it's actually a little bit, the information it's a little bit harder for me to process. So generally the recommendation is to go to a fully left justified only with the bullet points totally clean. That's the easiest and cleanest presentation, and it's going to look the most professional. Okay, text boxes versus graphics, depending on what you're doing. How much information do you have? Which one is easier to read? If you just had to look at them. And again, you guys got this on your handouts, I think. Very small. Okay. All right, so it might be that it's a text box, but if I've got a lot of information, I want to have all of these, and I had a text box describing that, that's going to be really hard to see. So the answer, there's not a right or wrong answer. It's what is going to be the easiest presentation. So you might try it with just a text box. So for example, if I'm talking about okay, so this was a research study about preceding symptoms of somebody going into a PEA arrest. If this side is just my demographics, I might just have that in a text box. But if I've got a whole bunch of a comparison of systolic blood pressure, arterial pH map, I've got graphics are going to work better for that rather than to try and describe it. So think about what it is you're trying to present. Generally, if you've got a lot of tables, again, that looks kind of scary and intimidating, but it might be the best way to do it. With the rest of these tables, these 6 tables we selected from about 12 or 18 variables. So we had a lot of run charts that we looked at for this study. And we hit the highlights, the ones that had the most biggest difference, the most impact as far as precedence. Okay, so to summarize, use a text box, create it, get it the way you want it, and then you're going to copy and you're going to clone it for basically all of the different areas of your poster. Use titles to make the titles very evident so that it's easier for people to kind of follow along on your poster. All right, differentiate the titles from the rest of the content, and then left justify with the bullets floating. All right, questions on that? Okay, a little bit about a typeface. How many of you have a favorite typeface? What's your favorite typeface? Futura, okay. Anybody else? I'm sorry?
I said the default.
The default. You know, you can set the default. Okay.
Arial.
I'm sorry, Arial. Okay. You can type. Okay, I'm sorry. Helvetica's good too. Okay, so the idea about a font, if you've got a specific font that you like and it's one of the kind of classic types of fonts, that's probably okay. Futura's maybe a little bit too stylistic. There is, Garamond. There's some that are very artistic, and they look okay for emails and for letters. But if you have a 4-foot by 6-foot poster of this, it's going to be really hard to read. So generally, selections for the typeface. When you're going to use them, you want to be able to see, by and large, you want to be able to clearly read the titles from about 4 feet away. That means that you are going to be using font sizes at least 24 points. Okay, so if you're trying to get things tight, if you do an 8-point font, it's going to look like a block. Okay, so you want to remember this is going to be seen from a distance. Okay, generally the rule is, and this is just graphics. So these are people that do the psychology of how we read and what is pleasing and professional looking. No more than 2 different fonts as a general rule. So you might use Arial and Verdana. You might use 2 different fonts. If all of this is starting to sound like a Charlie Brown teacher, pick a font that looks good. Show this one looks professional, and stay with that one. Okay. Now, generally, we also recommend that you stay in the same family. So there's 2 families of fonts. One is called a serif font. Okay, so a serif font, and this is example would be like Times New Roman. Let me see if I've got an example. Okay, here, we'll go with the next one. So if you see some of these, it's got this little thing on the top. That's called a serif. Okay, so examples of serif fonts would be Garamond. It would be Times New Roman. Serif fonts work really well in texts because it's easy remember we read the top of it, it's faster for us to read. Okay? There's some research out there to say it might actually be better remembered, which is why one of the reasons why people will use it. Sans serif fonts, so an example would be the one that I'm using on my slides. They don't have the little things at the top. So an example of a sans serif font would be something like Arial or Verdana or Tahoma. This, because it's slightly cleaner, is the most popular type of font that's used in websites. It's got a cleaner thing. It's used in a lot of technical writing because it may actually be more readable. Okay, it may not be as well remembered, but it's generally rated as being more readable. Ultimately, does it make a difference? No. If you prefer to have a serifed font that looks better to you graphically, that meets your aesthetics, then stay with the serifed font. Okay? If it doesn't, then go with a sans serifed. Okay? Now, the other thing with type fonts, once I decide which family I'm going to stay in, the other thing that's going to decide is something called kerning. Kerning is why I can have exactly the same sized font take up different space. It's the amount of space between the characters and on the spaces. Wouldn't you love to know this when you're in school? Because if you had a page limit or you weren't meeting your page limit, and they say it needs to be 12 point, they never tell you what font you need to use. So if you do, and my son figured this out at about 6th grade, if you use a 12 point Tahoma, which is a very wide kerned font, you will get a half page of space out of there. Okay, if you're like me and you tend to be more verbose, if you use something slightly more, slightly tighter, like Arial, you can stay within the page limit that the instructor gives you. Okay, so generally, if you're fighting for space, you can use a tighter kern. All right, and the way you're going to tell this, if you get the ones that you like, type the same sentence, and the ones that take up more space or have a wider kern. Generally, if again, it's a little bit easier to read from that distance if you use a wider kerned type font. Okay, some other things to avoid. What does all caps mean? I'm yelling, okay? Besides the fact that now we've got that kind of social, why are you yelling at me thing, remember when we skim, we go up at the top of the words. So I have to work a lot harder to read that. Right? So all caps, generally not good. Maybe for the titles if you don't have any other option, but generally there's a lot of other things to do. Okay. Oh, this isn't, okay. What about other sorts of fonts? I like scripted fonts. I like the Comic Sans. That's the most hated font. Somebody actually did a survey. And so Comic Sans, it's a nice big loopy thing, and it looks like you're in 6th grade. So try to avoid chillers. Try to avoid some of Gaudi. Try to avoid some of the kind of stylized fonts. They're really good for a poster that says, yes, we're having a potluck for Halloween. But don't use them for your professional poster, okay? Okay, and then, yeah, the italicized things, don't avoid those. If you want to make something, there was a really nice poster I saw. They took quotes out of a CAPS survey, and if you do an italicized Times New Roman, so it looked, italicize a font that's more professional looking, it kind of meets that. It's a quote, and I want it to be a little bit more flowery aesthetic. Okay, so generally things, keep in mind it's going to be, your poster is going to be seen from 4 feet away. You want to have everything large enough that people can see it from the middle of essentially what's going to be the walkway between the posters. No more than 2 different types of fonts, stay within the same family, and then use upper and lower case, so no all caps. Okay, any questions on that? Okay, color selection. Contrasting colors is a great way of pre-digesting things. Remember that how the titles were in a different color? So it's a great way of saying this is a title. This is something I want you to pay attention to. You can use color if I've got I'm trying to associate it across a variety of different things. An example, I helped somebody with a poster talking about, there's this thing called the lethal triad of death in trauma, which if your patient gets cold, they get acidotic, and they get coagulopathic during their resuscitation, their mortality rate goes high. So the woman's name was Darcy. So Darcy made temperature one color. She made acidosis or pH another color. She made coagulopathy a third color, and she color coded essentially the content in her poster. It sounds kind of complicated, but it was very slick. So use it as a guide. You can help navigate somebody around your poster by using things like color. Now, generally with the color, what we want to do is have legibility. So if you notice with the color, I've got a dark background with a light font. Okay, I wouldn't want to use a dark background with a darker font because that's not going to be as visual. Okay, so if I have a light background, I'm going to use a darker font. It's called contrast, and I want to have a very definite contrast in my color scheme. Okay, the other thing with color schemes, sorry, but 30% of guys have some degree of red-green color blindness. So generally, we don't recommend using red as one of the fonts because you're going to lose a certain percentage of folks. Okay? Questions on color? Okay, so again, I'm going to limit the color. I'm going to be very intentional about using it. High contrast. Okay, so organizing content. Where am I going to put things together for my content? What you want to do is play around with this. You want to have it in a logical manner. So going back to those sections or those chunks we talked about at the beginning, we want to have this story be able to hold up on itself if I'm not there to guide somebody through it. So we're going to organize it in a manner, and then we're going to place the important stuff, the take-home messages, those things we really want the audience to be aware of in more central locations because that's how our eyes are trained to work. Now, because we're used to reading English, that's how most of us learned, or some romance type language, we are trained that the top part, we go from top to bottom, left to right. So that information at the top is generally better processed and remembered than stuff in the middle. Okay? So my important stuff, like the title of my poster, because that's what people are going to look at first, who presented it, is all the way at the top in the middle. Okay? That's going to be a really important part. If I've got something with a big visual impact, it's going to be kind of in the middle. If I've got something that is less important, so for example, I told you there was some organizations where you had to have a reference list or you had to have the abstract. Okay, in my mind, that's kind of a silly thing to do, so guess where that went? All the way down at the right hand at the bottom. Okay, so you've got your thanks there. So keep in mind how we're kind of programmed to look at a piece of paper or a poster, a graphic representation for how you're going to lay out your information. So my take home is going to tend to be right under my title, right in the middle. Okay? All right. So when you organize content, remember less is more. If this looks like a big block, like I took pages from a book and I put it on a 4x6 piece of paper, people are not going to look at your poster. It's going to be too dense and it's going to look intimidating. In graphic parlance, they call this negative space. So I want to have some negative space to help break things up. I also want to be symmetrical as much as possible. So, and again, this is kind of how we're hardwired as humans. We tend to think of symmetry as being beautiful. If you look at somebody who's really attractive, they tend to have more symmetrical faces. If you look at something that is attractive, it tends to be symmetrical. It's a subconscious thing. So if it's symmetrical, it's going to look more professional. which means that you don't have all of your text on one side and all of your graphics on the other side. It looks lopsided. I might not be able to say why that doesn't look as professional as the same content organized differently, but that's why. So we want to try and get some sort of symmetry as well. Okay, so when you put it together, title gets the place of honor, because that's what's going to stop people. That's what's going to get the people that are walking through and doing the kind of art museum thing. That's going to be the biggest font. Okay, generally recommendations like 60, 70 point, big font. Okay, right under the title goes your name and your affiliation. Okay, again, there may be recommendations from whoever you're presenting. If it's your full name, if it's all of your credentials, if it's an initial and your last name. It also might depend on the work group that you're with. If I'm presenting something and I am one of 10 people, I'm not going to have everybody's full name because I don't want to give 4 inches of space just to the work team. Okay, but your name and affiliation always goes at the bottom. So it may be Mary Jo Kelly, Northwest Hospital. Okay?
You guys, and there's one other thing when you're doing these. Stephanie said us to say UW Medicine, Northwest Hospital. UW Medicine comes before Northwest Hospital. Sorry.
Well, look at it. It could be worse. It could be UW Medicine, UW Medical Center. That just gets redundant. I kind of feel bad for the folks at the... It's like, wait, they did that wrong. Okay, so right underneath their priority, what are my take-homes? What are going to be the catches? A nice catch could be a picture. Because you know what? We are also programmed so that we like pictures. So the picture needs to add something to it needs to be basically add something to your content. I helped somebody with a poster once. He was talking about, it was something in our pediatric ICU or pediatric burn patients, and it was some sort of program that they had created. Had a beautiful picture of a little kid with a teddy bear, and it took up quite literally all of this. It was like a poster of a little kid with a teddy bear with data kind of all the way around it. So it needs to be in a central location. Pictures are good, graphics are good, take-home messages are good. This is my important thing. All right. After that, then I'm going to do generally columns, because we like to have columns. Again, it looks nice and orderly. It looks more professional. So I'm going to tell a story, organize it in a logical standpoint. Less important stuff goes in the lower right-hand corner. Okay? If you've got something I want to thank somebody. I want to, this was my funding source. This is whatever it might be. That goes all the way down at the bottom. Okay. Logos again, you want to try and be symmetrical about it. And you kind of just play around with where they are depending on what your graphic standards are. All right. So as I mentioned, yes, use pictures. If this is a clinical thing and you can get pictures from your unit, that's a great way to get people to stop and pay attention. My theory is that it kind of relates to some voyeuristic tendency that a lot of us have, that we want to see what other people's units look like. It's like you're kind of walking down the street at night and looking in the windows. So yeah, action pictures are good. Again, make sure that they enhance your content rather than overpowering it. Remember the kid with the teddy bear. And the other thing, when this goes to print, it needs to be a sufficient resolution. The worst thing you can do is have a picture and have it look really grainy. So generally there's recommendations that most of your printer will give you. I'm gonna screw it up. So ask them about what resolution the graphics need to be. Okay. And the same is true for diagrams and charts. They also count as pictures. Now, what I recommend doing while I'm playing around with this, I'm going to show you how to do this in PowerPoint. Make several versions of it. Play around with it, because again, there is no right or wrong. These are general concepts I want you to keep in mind, because they will make your poster look more professional. But if you have your purpose here versus your, I've got it over here, or whatever it kind of makes more sense to do. Having a couple of different versions of the poster is probably the best way of doing it. If you are not facile with a computer, then print it up and put it on a table and then play around with the content that way and take pictures with your phone. And then show it to Mary Jo or to some of your friends and say, okay, which one of these looks better? Which one of these makes more sense to you? Okay? And then I also recommend, showing it to somebody who isn't familiar with your project. Does this content make sense? Because sometimes you, as someone who's lived and breathed whatever project you're writing your poster on, make certain assumptions that other people might not necessarily make. So you may be missing a key chunk for somebody that is not familiar with the content that needs to be included in your poster. Okay? All right, so prioritize your information, be symmetrical, use anchors like the pictures and the graphics, and have fun with it. All right? So, some things before you go to print. I recommend always giving yourself more time. Printing, depending on if they tell you it's going to take 48 hours, at least double or triple that. All right, so for those of you that kind of live by external deadlines, also known as my fellow procrastinators, you want to allow yourself a lot of extra time. The other thing that I recommend doing is if you can get into a room like this, before you go to print, put your poster up on an LCD projector like this. Okay, this is bigger than it's going to be, and you know what? If you missed, a text box where all of a sudden your text started wrapping, so it's now equal to where your bullet points are, that will work. My personal trauma story, we had, remember that the lethal triad of death? Okay, there were a lot of greater than or less than signs in that. We got every single one of them backwards. And do you know when we figured that out? When we got it back from print. Not the draft. Because the drafts, you'll get little drafts, they're about yay big. No, this was the full 4x8 poster, and somebody who hadn't seen it, and a lot of people had looked at this poster, hadn't seen it. It's like, isn't it supposed to be the pH of less than? Like, yeah. Like, no, it says greater than, and every single place we got it backwards. So, have people who haven't looked at it, look at it. Create enough time if you're organized enough to do this so that you don't look at it for a couple of days and then you'll have fresher eyes. But the best thing I can recommend doing is to project it on a big screen and have a bunch of people look at it. Wow, you know what? I've got a whole third font there. My colors aren't the same. It really does make a difference. All right. Okay, so again, presenting your poster. We're talking about, doing a poster does not end with getting it back from the printers. You need to think about this as kind of like your first public speaking thing. We call this an elevator talk. I need to have a spiel to try and get people to come and see my posters. Because generally, if you're doing this at a conference, there's going to be a time when you get assigned to stand by your poster. Okay? And again, the people that are interested in your topic that are going to seek you out are not the ones you're going to go after. All right? They're going to be the people that are kind of walking by and kind of looking like this and and you have a couple of questions. So if you go back to that canine therapy poster that I showed before, it might be something like, oh, does your hospital have a canine assisted therapy program? Well, let me tell you a little bit about ours. This is what we've done. And we can give you some of the data. So I'm not going to take 5 minutes of their time. It's going to be a 30-second thing. And you need to have that programmed. Even if you do this for a living, you stand up like I do in front of people and talk a lot, I want to have it nice and tight, 30 seconds, and so that I can start getting people and starting those discussions. That's the best way of doing it. Okay? They will very often talk about maybe having available handouts or links. By and large, a lot of conferences will have the abstract of your poster, but if you don't want to come with 300 copies of your color poster, maybe just getting some business cards or something, sheets of paper. This is my email. I'd be happy to start to send you a copy of the poster. It's a great way of professional networking. All right, I've got some people that I met at a trauma conference 15, 20 years ago that it was a poster, and that's how I started my relationship with them. So it is a great opportunity for professional networking. Okay? So, in summary, all right, this is a great beginning for your for a professional presentation. You need to allow extra time, and you've got a lot of excellent resources here as far as people that can help you plan it out, and have fun with it. Okay?